our session on vasculitic disorders. Vasculitic disorders include inflammatory disorders of the blood vessels. They're caused by inflammation caused by either autoantibody-dependent cytotoxicity, what is known as type 2 hypersensitivity, or type 3 hypersensitivity, which is antigen autoantibody complex deposition. These vasculitides are characterized by size of the vessel as involved. You have large vessel, medium vessel, and small vessel vasculitides. The large vessel ones classically are the giant cell or temporal arteritis or Takayasu's arteritis. Medium vessels are polyarteritis nodosa and Kawasaki's. Small vessels is your classic Wegener's granulomatosis or Berger's disease. You have stages of vasculitis where you have acute inflammation that's either granulomatous, such as that seen in large vessel, necrotizing, or both, and then you have healing by fibrosis following that. The clinical consequences of these stages of inflammation followed by fibrosis lead to narrowing of the vessels and/or thrombosis or infarction distal to the occlusions. So giant cell arteritis or temporal arteritis is an incredibly important member of the vasculitides, mostly because it is tested quite frequently, and it's tested quite frequently because I think the consequences of mismanagement of this disease process are dire. It's the most common form of the vasculitides. It usually affects elderly. It affects temporal, facial, and ophthalmic arteries. Symptoms include headache, vision changes, and systemic flu-like symptoms. And if it's left untreated, it may cause blindness. The typical treatment for Takayasu's is steroids, and steroids need to be given as soon as the entity is suspected. Takayasu arteritis is the most common vasculitis in Asia, affecting young women, 15 to 45 years old. It affects branches of the aortic arch, and the classic presentation is pulselessness of the upper extremities and vision changes. Polyarteritis nodosa affects young adults. Typically, there's a preponderance for males rather than females. It's a systemic disease, especially involving the kidneys and the GI tract. You may present with fevers and malaise, kidney failure and hypertension. You also have significant abdominal pain and GI bleeding. It is associated with a positive P-ANCA antibody, and if it's left untreated, it can be fatal. Kawasaki disease is typically a disease that pediatricians see. It's a disease that affects infants and young children. The signs and symptoms of Kawasaki's include fever, conjunctivitis, and oral erythema. A generalized maculopapular desquamating rash develops, and you have significant cervical lymphadenopathy. It's self-limited. Typically, it only carries a 1 to 2% mortality, which typically is from thrombosis or coronary aneurysm. Wegener's granulomatosis occurs in middle age. It's relatively rare. It's one of our classic pulmonary renal syndromes. So you see bilateral pneumonitis in addition to necrotizing glomerulonephritis. You can also have nasopharynx involvement with chronic sinusitis and ulcerations. In contrast to polyarteritis nodosa, this is associated with a C-ANCA positive antibody. It's a very high mortality if left untreated. Berger's disease or thromboangiitis obliterans occurs in young males, especially heavy smokers is the classic clinical vignette associated with it. It affects the extremities, leading to claudication, thrombophlebitis, secondary to vascular inflammation, ulceration, and ultimately it can cause gangrene. It improves with smoking cessation. And here's a picture of Berger's disease where you can appreciate an abscess and neutrophils infiltrating the vessel wall, and the lumen of the vessel is completely occluded. So, a 70-year-old female complains of headaches for the last several months. Physical exam reveals a prominent, painful temporal artery. Biopsy reveals mild atherosclerosis only. The patient's condition responds to corticosteroid therapy. What is the most likely complication of this patient left untreated? So this is kind of a classic question that would be asked, and in fact, this probably gives more information than most questions would give. And typically say an older woman who presents with a painful temporal region. The ESR might be elevated and might have some vision changes. And if left untreated, if this patient does not receive corticosteroids, then blindness will ensue. So the right answer is C.